Wouldn't it be nice to be treated like a billionaire? You can be, medically at least. I'm Dr. Odysseus Argy, and I'd like to share with you some unexpected insights that I've learned about how you can get superb medical care without being rich. These insights come from several professional sources, including my work as a surgeon for 30 years, during which I cared for and taught thousands of patients. Here's a surprising theme that you will hear throughout this presentation. Getting great medical care is a process in which you play an active and crucial role by understanding yourself, your illness, your doctor, and the medical system as a whole. With that in mind, here are 3 simple insights you can follow to get excellent medical care. The first insight: you need to have a superb relationship with your doctor. The second insight: you need to have an advocate, especially as you get more advanced care from a specialist. The third insight: you need to understand yourself and your illness as much as you can. Let me expand on each of these insights, and you'll see that they overlap with one another. The first insight: you need to have a superb relationship with your doctor. Most people don't realize how vital it is that you have the right doctor for you, because the excellent relationship includes your doctor as your caregiver and also as your advocate, your teacher, and your friend. The power and benefits of this relationship in your care are dramatic. When most people think about medical care, they think about science. Getting superb medical care is more than just science. It's about relationships at many levels. It will surprise you to discover that your relationship with your doctor is actually one of 4 doctor relationships of which you should be aware, because they all play a role in you getting excellent medical care. They are your relationship with your doctor's relationship with themselves as a person and a medical professional, your doctor's relationship with other doctors, and your doctor's relationship with the entire medical system. I call these relationships the medical mindset. Think of the medical mindset as 4 interconnected circles of relationships, like a Venn diagram, which all overlap with you at the center. Let me talk about them a little bit more. The first and foremost relationship is how you and your doctor interact, with communication, adaptability, respect, and trust to optimize your medical care. The second relationship is how doctors think about themselves, their work, and their patients in general, so your doctors feel they are doing productive work with you in particular. You may not realize that the burnout rate among doctors was 50% before the pandemic, and is certainly higher now. Your excellent connection with your doctor can help lower that burnout rate. The third relationship: how doctors interact with other doctors as colleagues. Most medical care is delivered with the cooperation of multiple doctors in different specialties, and doctors typically place a high value on the input of other doctors. And the fourth relationship: how doctors interface with the complexities of the entire medical system. It's remarkable how much you can do to make sure that all 4 of these relationships overlap with you at the center. It starts with what I call the art, the A-R-T of connection. The art of connection is the foundation on which all strong relationships are based, including patient-doctor relationships. You and your doctor need to share mutual adaptability, mutual respect, and mutual trust, the art of connection. That foundation is then built upon by knowing yourself, knowing your illness, having a positive, pleasant attitude, being motivated to work constructively together with your doctor, and using effective communication. Let me share a few words about the important topic of effective communication, which forms the basis of interpersonal connections. In my experience, communicating effectively is not intuitive for the majority of people, since most of our communication is automatic and non-deliberate. I've interacted with many thousands of patients and coached almost 5,000 surgeons in effective communication skills and problem solving, with one very clear conclusion: Optimized communication skills and enhanced decision-making can definitely be learned and mastered by both patients and doctors. I've also done research and lectured for 20 years about how that patient-doctor relationship has, among many other features, 4 major benefits, which are an integral part of getting superb medical care. First, improved satisfaction. Both you and your doctor will be happier with your interaction and your care. Second, better cooperation between you and your doctor. Third, more effective treatment plans are developed together so that they are more likely to be followed and be successful. And finally, you will have a significant improvement in your medical outcomes. Having this approach to communication, connection, and problem solving will maximize your ability to have a great relationship with your doctor and is really reinforcing for both of you. And it's easier for doctors to navigate the complexities of the entire medical system when you are doing what you can as a patient to make that as successful as possible. The conclusion is you should do everything you can to have that excellent relationship with your doctor and enjoy all its benefits. Here is the second insight about how to get great medical care. You need to have an advocate, especially as you get more advanced care from a specialist. As I said earlier, doctors place a high value on the input of other doctors. So you, as a patient, want to have a primary care doctor who acts as a strong advocate for you. This is especially true if you need a referral to a specialist from your primary care doctor. The referral shouldn't simply be a form that's filled out and given to you or is emailed to the specialist's office. Be sure that your referring doctor takes the time and effort to make a phone call to the specialist, even for 2 minutes, on your behalf. That phone call is going to have a positive impact on the specialist and on your care, and is one of the reasons why it is so important to have the right doctor who's going to act as your advocate. Let me move on to insight number 3 for getting great medical care. You need to understand yourself and your illness as much as you can. And I don't mean an internet search with Dr. Google. I did a search of breast cancer and got over 500 million results in less than 1 second. It is completely overwhelming. Oh, while I'm on the subject, here is an important point that most people do not realize. Please remember, only with experienced guidance can the internet be a source of useful health information on which medical decisions are based. It's another talk in and of itself. What you really need to help you know your illness is what I call a medical mentor, someone you trust, who understands medicine and who understands you. Optimally, this will be your physician. The medical mentor, whether your primary care doctor or a specialist, can summarize the essentials of what you need to know about your problem and direct you to resources from which you can learn more. Once you've done some reading, you can go back and talk again with the medical mentor to make sure you really understand the problem as much as you can. With the help of a medical mentor, not only will your knowledge of your illness allow you to make better decisions about your care, you will also be able to have more intelligent and thoughtful discussions with your doctor, enhancing your relationship with her or him. It's not commonly realized that doctors are always positively impressed by patients who understand the basics of their disease and are able to be engaged active participants in their care rather than being passive recipients of care. Not all the choices will be easy, and there can be uncertainty, yet you can be that active participant and enjoy all the benefits that come with it. These first 3 interrelated insights, having a great relationship with your doctor, making sure your doctor acts as your advocate, and learning about your medical problems with a medical mentor, raise an important point. How do you pick a primary care physician who will not only take great care of you for routine problems, but will help you learn about your illness and advocate on your behalf when you need procedures or a specialist? It's not likely that you'll be lucky enough to be assigned to a doctor and by coincidence have that good match, that good connection. which means you're going to have to choose your doctor very deliberately. Essentially, you need to interview your doctor, and you should do 4 tests: the time test, the translation test, the transparency test, and the attention test. Let's talk about each of them. First, the time test shows you that the doctor will take her or his time and will not be rushed or try to get you out the door. You bring in your list of issues to discuss, and the doctor goes over them with you, even if it takes an hour. Second, the translation test. The doctor should be able to translate, that is, explain your medical problem to you at your level of understanding, so you can use that understanding to make good decisions. Third, the transparency test. The doctor is able to clearly explain all the aspects of a problem, even the less likely possibilities. For example, let's say you have high blood pressure. The doctor explains that there are 4 major classes of drugs that are used to treat high blood pressure and describes the risks and benefits of each so you can make an informed choice that works for you. That is being transparent. The non-transparent approach would be to simply give you a prescription for a drug without explaining any of the options, risks, or benefits. Finally, the attention test. Your doctor should be facing you and not be distracted by something else, like a smartphone or the computer. This, by the way, is my doctor, who is paying attention to the electronic medical record in the computer. But I assure you, for most of my visit, he was facing and paying attention to me. You can also apply these 4 tests to help you choose a specialist. In summary, I've introduced you to how you can get the excellent medical care you deserve. Here again are the 3 simple insights to do so. The first insight: you need to have a superb connection with your doctor by being an excellent patient and communicator, allowing you to benefit from greater satisfaction, more cooperation, better treatment, and improved outcomes. The second insight: you should have an advocate, specifically your primary care doctor, especially as you get more advanced care. The third insight: you need to understand your illness and yourself as much as you can, particularly with the assistance of a medical mentor who will act as a resource for information. To ensure that you have the right doctor for you, you should conduct an interview of her or him and do the 4 tests: the time test, the translation test, the transparency test, and the attention test. Yes, you too can get medical treatment like a billionaire without being rich.